Good morning, everyone. I'd like to welcome you to Jersey College at WellSpan Health. What a great day for Pennsylvania today. My name is Patty Donnelly, and I have the pleasure to serve as the Senior Vice President and Chief Nursing Executive at WellSpan Health. It's a true honor to be here today with all of you to celebrate this important milestone for healthcare in Pennsylvania. We'd like to thank Governor Josh Shapiro, his administration, our state lawmakers, and all of the other stakeholders for their tremendous work and shared commitment to improving our workforce infrastructure. I also want to acknowledge the elected officials and distinguished guests with us here today, many of whom supported this bipartisan effort to strengthen Pennsylvania's workforce. First, State Representative Frank Burns, Chairman of the House Professional Licensure Committee. County Commissioner Doug Hoke. President and CEO of WellSpan Health, Roxana Gapster. Greg Karszewski, Chancellor of Jersey College School of Nursing. Joe Crosswhite, WellSpan System Board Chair. And Laura Wagner, Campus Administrator at Jersey College School of Nursing. So on behalf of WellSpan Health and the broader nursing and healthcare community, I want to express our excitement and gratitude for Pennsylvania's implementation of these interstate healthcare licensure compacts. These compacts open new opportunities for Pennsylvania by allowing licensed professionals from other states to bring their talents here to work in the Commonwealth. By reducing administrative burdens, wait times, and streamlining licensure processes, we can now respond faster to patient needs and ensure continuity of care across state lines. This will have a positive impact on both patients and team members. For health systems like WellSpan, this means there are more hands, more support, and more time to focus on what matters most, our patients. At WellSpan, we've long been committed to expanding access to high-quality care, whether that be partnering with the Lewis Katz School of Medicine at Temple University to establish our forthcoming medical school right here in York, leveraging technology and innovative tools such as virtual nursing options, and of course, fueling our future pipeline of nursing professionals at Jersey College School of Nursing right here in this building. Thank you all for being a part of this important moment together. Together, we are all working as one to advance healthcare in Pennsylvania. And now it is my great honor to introduce Governor Josh Shapiro. He has placed a special emphasis on workforce development in the healthcare industry, a critical lifeline for our communities. And under his leadership, processing time for key professional licenses has dropped significantly. Registered nurse and licensed practical nurse licenses have gone from 25 days to just 5 days. Physician licenses have gone from 43 to 10 days, and physical therapist licenses from 31 to just 3 days. Please join me in giving a warm welcome to Governor Josh Shapiro.
Thanks, Patty. Thank you. Thank you, Patty. Thanks, Patty. I appreciate you and Roxana and the entire team here at WellSpan. This is an outstanding healthcare institution, and I enjoy the important work you do in the healthcare space. And I also want you to know your CEO, Roxana, sits on numerous important economic development boards across our Commonwealth and does really, really important, valuable work for this institution and the entire region. So thank you. It's good to be with you. I want to say how cool it is for me to be here with all of these RNs. I want you to know that I had hoped as I was growing up to be a doctor like my dad. Apparently you have to take organic chemistry and calculus and things like that. Obviously didn't work out for me, but some of my earliest memories are as a little boy, maybe 5, 6 years old, making rounds with my dad, which I thought was the coolest thing in the world. I got to spend time with my dad. My dad's a pediatrician. He would always go in for a C-section. Thank God I didn't know what a C-section was. When I was making rounds with him then, I probably wouldn't have wanted to go back. But I remember vividly every different hall we would walk down, room we would walk in. My dad would point out who the nurses were and tell me, they're the ones who were really in charge of the place. No offense, Roxana, but I think everybody knows how valuable and important nurses are. We also know that we need more nurses in Pennsylvania, which is in part what brings us here today. So I'm honored you would spend some time with me. Thank you very much, and thanks for the work you do for patients every day. It's good to be back in York County. It's good to see my friend Commissioner Hoke, and it's good to be here to cite yet another example of how our administration is cutting red tape and advancing freedom, in this case, for our healthcare workers all across our Commonwealth. And we're proud to use WellSpan as the place where we are announcing this initiative because of how much foresight they have in numerous initiatives to create more opportunities for healthcare workers in Pennsylvania. As of today, after a whole lot of work by a whole lot of people, Pennsylvania, I'm here to announce today, is now a full participant in 3 multi-state licensure compacts that allow doctors and nurses and physical therapists to quickly and easily get licensed to practice now in dozens of states. This is something that folks in Harrisburg, folks in our state capital have been talking about and trying to accomplish for years. Representative Burns, who you'll hear from in a moment, the chairman of the committee with oversight on this, and by the way, a state representative from the Johnstown area, but is here today in York because of just how important this issue is. I believe he voted on this issue about 9 years ago in the House of Representatives. And I'm proud that under Secretary Al Schmidt's leadership, my administration finally, after many years, got it done. Let me explain why this is important. Here in Pennsylvania, we are facing significant shortages of healthcare professionals, especially in our rural communities. In urban counties across Pennsylvania, there is one primary care physician for every 222 residents. In our rural communities, there is one primary care physician for every 522 residents. More than 850,000 of our neighbors in Pennsylvania live in communities that do not have enough health care providers, according to the federal government. Statewide, today, 14% of nursing jobs are vacant. And in rural communities, that percentage of unfilled nursing jobs jumps to 26%. That's 1 in 4 in those rural areas. And unfortunately, the challenge is only getting worse. By 2026, we're expected to have a shortage of 20,000 nurses in our hospitals. So today, as just one way to be able to combat this, we're making it easier for qualified medical professionals from dozens of states to now provide care right here in the Commonwealth of Pennsylvania. We are doing that by cutting red tape, speeding up licensure times, as you heard from Patty a moment ago, and making it easier for qualified medical professionals to get to work in our hospitals and clinics and in our doctors' offices right away. From day one, my administration has been serious about cutting red tape and making government work more quickly. In my first week in office, I signed an executive order to overhaul the process of reviewing our permits, licenses, and certifications like those that doctors, nurses, and physical therapists are required in order to do their jobs in Pennsylvania. As a result of that executive order, we aggressively reformed our permitting process. We sped up government, we slashed wait times, we removed backlogs, and we finally are fixing our permitting processes after all these years of neglect. We went from the bottom of the pack on occupational licensing to one of the best states in the nation. The wait time for a registered nurse and licensed practical nurse license went from 25 days to just 5 days. You heard before, but it bears repeating. Physician licenses went from taking 43 days to about 5. Physical therapist licenses went from 31 days to about 3. to get a pharmacist license went from 26 days to 5. And let me tell you, with as hard as Al Schmidt works, we're not satisfied with those numbers. We're going to continue to make progress, and we're incredibly proud of all the team at the Department of State has done to speed up those times. Now a trained nurse or doctor or physical therapist can not only get their license faster, it means they can also get on the job treating patients far more quickly. Joining these medical compacts, as we are announcing here today, doubles down. What do you think? Is it doubles down or double downs? Yeah, we'll just say double down, Roxana said, okay? We're doubling down on that progress. Folks who are fully trained and licensed and live in another state can practice in Pennsylvania with ease now. And if you decide to move here to Pennsylvania, you can use a fast, streamlined process to transfer your license to our Commonwealth. So now a nurse like Hollis King, who you'll hear from in just a moment, who lives just across the border in Maryland, though we're already working on getting her here to Pennsylvania, can more easily and quickly get a job here in York County with WellSpan. We're creating more job opportunities for her and thousands of nurses like her and helping WellSpan compete for talent. Imagine a doctor, for example, who was born and raised here in Pennsylvania, but then went to college and medical school out of state, got licensed, say, in Illinois or New Jersey or Colorado, or one of the other states that are involved in this compact. Now, when she wants to come home and live and work closer to her family and community that raised her, she can do so with ease. Thanks to this compact, she can do that faster and more easily. Previously, even though she was licensed in another state, she'd have to go through our entire licensing process, which at times, depending upon the particular specialty, could take upwards of 4 or 5 months, depending again on that area of practice. Now, that out-of-state license that's part of that compact will be recognized within just days here in Pennsylvania, and that is going to allow that physician to be able to get to the bedside far more quickly. My administration is working to expand our healthcare workforce and address these critical shortages so more Pennsylvanians can get the care that they need, care that they deserve in the community where they live. We're, of course, doing that by cutting red tape, and we're doing that now by this compact and looking in the out years, looking into the future, doing that by investing through our state budget process. Way back in February, I proposed 2 key steps to expand our healthcare workforce as part of my annual state budget. First, I want to create a new loan repayment program specifically focused on healthcare professionals who take jobs in our rural communities. My budget would help pay off student loan debt for doctors and nurses who agree to serve at least 2 years in a rural community. Second, my budget strengthens partnerships between hospitals and nurse education programs that guarantee nursing student jobs once they graduate. Let me explain how this works and another reason why I'm here at WellSpan today. Hospitals know that they need more nurses, so they partner with local nurse education programs to offer guaranteed job placements to nurses after they graduate. Hospitals get a guaranteed workforce of trained nurses that they can rely on to fill their jobs. And nursing students, well, they get the peace of mind knowing that they will have a guaranteed job upon graduation and receive help covering their tuition in the meantime. Altogether, our communities get a much stronger pipeline of well-trained nurses taking jobs in local hospitals and the communities that they love. WellSpan knows the importance of training great nurses in our communities and helping them get jobs in our communities once they are fully trained. That's exactly what they're doing here at WellSpan Education Center. My budget will help more communities build the kind of partnerships that exist here at WellSpan and cut the costs for nursing students while making communities healthier and giving them a pipeline to opportunity right here in the Commonwealth of Pennsylvania. Right now, Representative Burns and his colleagues in the General Assembly are considering that budget that I announced about 150 days ago. I am grateful for Representative Burns's support. You know, here in Pennsylvania, we are one of the only states in the nation with a divided legislature. where the Democrats control the House and the Republicans control the Senate. That means that no one gets everything they want, and the name of the game is compromise in order to get big things done. We've done that over the last 2 years, working together, Democrats and Republicans alike, to make strides in workforce, make strides in the education, make strides on public safety, and of course on economic development. I'm confident that we'll be able to do that again. My team and I are actively engaged with the leadership of the House and the Senate. While everybody was at the beach or spending their time at barbecues this weekend, we were pouring through the state budget. And I want to thank my team and the team from the Senate and the House for all of their hard work over the weekend to make sure that we're advancing important causes like this, to make sure that we have more nurses across this Commonwealth, particularly in our rural communities, and to work on so many other important initiatives to the future health and success of our Commonwealth. We're going to continue in my administration to speed up government, to cut through the red tape, to make government easier for people to work through in order to achieve their dreams right here in the Commonwealth of Pennsylvania. The person who leads that effort for us, who makes sure that we are able to cut through the red tape and speed up government, is the person in charge of signing all these licenses, by the way. This is the guy you really want to know. And that is Secretary Al Schmidt, the Secretary of our Commonwealth. And it's my pleasure to invite him up now for a few remarks. Secretary Schmidt.
Thank you, Governor. Today marks the culmination of Pennsylvania's nearly 10-year journey to full implementation of these healthcare compacts. This critical achievement demonstrates the Shapiro administration's continued commitment to reducing barriers to licensure for qualified professionals in life-saving healthcare professions. There are many advantages to this full implementation. Fully participating in these compacts increases Pennsylvania's profile as a competitive place for healthcare professionals to live and to be licensed to provide care for patients nationwide. And if you've ever spent 5 minutes with the governor, you know how very competitive he is and how supremely confident he is in Pennsylvania's position to compete. These compacts allow doctors, nurses, and physical therapists living in compact states to practice in Pennsylvania, supporting a more robust healthcare workforce. And importantly, full implementation will also provide Pennsylvania patients with expanded access to telehealth services. Just by way of a quick background, the Shapiro administration has carried across the finish line a goal set in 2016 by the General Assembly in a bipartisan way when it approved Pennsylvania's participation in the Interstate Medical Licensure Compact for physicians, which is soon followed by the Compact for physical therapists and for nurses. It's been an arduous process involving many steps to get to this day. And I'm confident the governor and the Pennsylvania Department of State have redefined the definition of the word persistent when working with our federal partners at the Department of Justice and FBI in order to bring about final approval. While the Shapiro administration was able to partially implement the Nurse Compact in 2013 and the Physician Compact in 2014, one major hurdle remained to full implementation, obtaining the U.S. Department of Justice approval for Pennsylvania to receive FBI fingerprint-based criminal history record checks for applicants to safeguard the health and safety of Pennsylvanians. The Department of State's Bureau of Professional and Occupational Affairs, BPOA, has been focused on working with DOJ, the state police, and a bipartisan collection of congressional allies to obtain that approval. We secured approval and then worked swiftly to complete the final administrative steps. The rigorous process we followed reflects the Department of State's responsibility to protect public health by thoroughly vetting all professional healthcare license applicants to ensure they are qualified to practice in Pennsylvania. Finally, I want to thank our state and federal partners who helped make this day possible today. And now you'll hear from Stephanie Watkins from HAP.
Thank you, sir. Thank you. Hey, Stephanie.
Good morning. I know I'm the speaker in between you and hearing from Hollis, so I'll try and speed this up. But good morning. I'm Stephanie Watkins. I serve as Senior Vice President of Advocacy and Policy for the Hospital and Health System Association of Pennsylvania. HAP advocates for the Commonwealth's hospitals and health systems and the patients and communities they serve. Today, as you heard, we are celebrating the finalization of what has been years-long effort for many organizations and individuals to make it easier for healthcare professionals to come to work in Pennsylvania and care for our communities. Implementation of the Interstate Licensure Compact removes a barrier to growing Pennsylvania's healthcare workforce. Recruiting from out of state just got more streamlined, and doctors and nurses who are already licensed can begin caring for Pennsylvania sooner. Why is this necessary? We cannot have high-quality, accessible healthcare in Pennsylvania communities without the talented healthcare professionals that provide that care. The Commonwealth, as you heard, continues to be in the midst of a healthcare workforce crisis, which will only worsen as the Commonwealth ages. More doctors and nurses are reaching retirement age just as they need for care is increasing due to our aging population. Our most recent survey of Pennsylvania hospitals found that despite hospitals and health systems' extraordinary efforts to develop, recruit, and retain healthcare professionals, we have a 19% average vacancy rate for registered nurses statewide, 21% in rural communities. Statewide, but especially in our rural areas, we need many more physicians to fill care gaps and critical services that communities depend on, like primary care and maternal and infant health. The interstate licensure compacts are another important tool for our hospitals and health systems to recruit the healthcare professionals our communities need. HAP would like to thank the bipartisan group of leaders at every level of government who work collaboratively to make this important step happen, including the Shapiro administration, leaders in the General Assembly, and U.S. Representative Brian Fitzpatrick. But our work is not done, and HAP stands ready to work with our state leaders on next steps to grow and strengthen our healthcare workforce. Steps include targeted investments, like the governor just spoke about, to incentivize health professionals to work in rural and underserved communities, strategies to bolster nurse education programs and nurse educators who are needed to develop the next generation, and action that addresses Pennsylvania's medical liability climate to make the Commonwealth a more attractive place to practice medicine. Hospitals are willing to partner and build upon the success from today and strengthen the healthcare workforce of our communities that our communities need. So without further ado, I'm going to turn it over to Hollis King.
All right, Hollis, you're up here.
I'm up.
You got this.
I'm Hollis King. I'm a student here at Jersey College. I received a grant from WellSpan Hospital that really influenced my decision to attend Jersey College. I'm gaining a great academic foundation and a high-quality clinical experience. I currently live in Maryland, so I am very excited about this, as Maryland is a nursing licensure compact state already. Now I can join the compact here with Pennsylvania. This just allows nurses like me who live in a compound state but also train in another to easily get a job anywhere. And with the healthcare being such a competitive market, we can easily transfer across state lines and take job opportunities that we wouldn't normally get. I view the compact licensure as a strategy in advancing my nursing career, as it not only expands career opportunities, it supports a work-life balance, and it also enhances the adaptability of a fast-changing healthcare environment. I am beyond proud of Pennsylvania and also so thankful to all of the people who helped implement this to not only better our nursing careers, but also the communities that we serve in and the patients that we help out. So thank you.
Great job.
Thank you.
Good work. You did it.
This is also going to be Representative Frank Burns coming up. That was a huge part of this.
Chairman.
Well, good morning, and thank you, everybody, for being here. I'm proud to stand here today to celebrate the full implementation of interstate licensing compacts. As chairman of the House Professional Licensure Committee, we have worked diligently with the governor's administration to make sure that these vital healthcare compacts could finally come to fruition. And it was a long process, but we got here. And I'm proud to have been the sponsor of House Bill 2200 last session, which provides the guidelines and requirements for implementation of fingerprinting as part of the criminal history background check, which makes the licensing compacts possible. This bill was the final piece of the puzzle needed to allow Pennsylvania to become full participants in the medical and physical therapy and nursing compacts. None of this would be possible without the bipartisan efforts in the House and the Senate. And none of it would be possible without the Department of State working with the FBI and the Department of Justice to find out exactly what was needed and what Pennsylvania had to do. But certainly, none of it would be possible if it wasn't for Governor Josh Shapiro and his desire and push to cut red tape and to get stuff done for the people of Pennsylvania. So thank you, Governor Shapiro, for all that you do.
Thank you, Mr. President. Thank you. Thank you very much. Thank you. I know sometimes the legislative process can seem a bit slow or a bit arduous, but when you have a champion like Representative Burns, Chairman Burns, who wants to see something through over literally a decade, that's pretty impressive. And I hope that that gives everybody here a sense of fulfillment and a sense of comfort and belief in their elected officials who are out working hard every day to make sure that the people of Pennsylvania are well cared for and well looked after. And Representative Burns is a great example of that. And so I appreciate his leadership and appreciate you being here today. And with that, if there's any questions from the media, we'll be happy to take a few.
First of all, can you clarify how many states are within the compact first? And then second of all, can you talk about the concerns you heard from hospitals in the lead up to the signing of the compact about the challenges they're currently facing at this moment?
Let me handle the second part of it, and then Secretary Schmidt can speak about the other states. I want to thank our nurses for diligently standing up here. Let me say, we heard from healthcare providers all across Pennsylvania that they need more nurses, especially, more primary care docs in rural areas, and many others as well. Those are just two examples that we heard over and over again. That prompted some of the investments in my budget, and it prompted us to really put on overdrive this effort that's existed for the last 10 years to get this compact done. We listened to our healthcare providers and we're delivering for them. And it's common sense, right? If you're licensed, if you go through all the testing and all of the stuff you got to go through in order to be a nurse, be a doc in one of those other states, that should be good enough for us here in Pennsylvania. And rather than just having bureaucracy take over and months delays, we want our healthcare providers in other states to know they're welcome here, they're needed here, and we want them here in this Commonwealth. As for the other states, I'll leave it to the Secretary to walk through that.
There's really three separate compacts we're talking about here: nursing, nurses, physicians, and physical therapists. Each has about 30 states associated in the compact. A couple of those, about 40 states.
And if you need a specific list, we're happy to provide that. Rosie will make sure you get that after. Yep. Hey.
Governor, the federal reconciliation bill is projected to really decimate rural hospitals and perhaps even nursing homes. Can you talk about what you see the Commonwealth being able to do to stave off just a decimation, a further decimation?
Let me make sure we level set here, and everybody knows the effect of the law that the president just signed a couple days ago, that every single Republican member of the House, with the exception of Congressman Brian Fitzpatrick and our Republican U.S. Senator, voted for, knowing what they were voting for. 310,000 Pennsylvanians are going to be kicked off of Medicaid. 140,000 Pennsylvanians are about to lose their SNAP benefits, that's the food assistance benefits. And we have about 25 rural hospitals that are both working with an operating deficit where about 50% or more of their revenues are coming from public payer, right? Coming from Medicaid. And so if you're already facing a deficit and your Medicaid is being slashed, we estimate that there's about 25 rural hospitals that are likely to shutter in the next few years because of this. Here in York County, just to put a finer point on it, 9,762 York Countyans are about to lose their Medicaid because of this vote, and about $11 million is going to be ripped away from SNAP just here in York County. So I want you to know what they voted for, okay? They voted to give a tax cut to those at the highest income brackets who frankly don't need it, and to pay for it by slashing Medicaid and SNAP and harming rural hospitals. This isn't politics. This isn't hyperbole. They knew what they were voting for. They voted for it. It's now law in Pennsylvania. As to the second part of your question, let me be very clear. Pennsylvania can't backfill this. We don't have the money to do it. I warned these members of Congress that we couldn't do it. And so the cuts that are about to come are coming as a direct result of how your federal representatives voted here. We can't fix this for them. They're taking billions of dollars away from Pennsylvania, and we can't make up for that. And so this is our sad new reality, that the federal government of the United States believes in knocking millions of people off of Medicaid, millions of people off of food assistance, all to pay for a tax cut for those at the highest income brackets. I don't think it's right. I made my voice heard on this. Those representatives chose to vote the other way, and now the consequences hang on them.
Governor, one more from Fox 43. Mr. Governor, how do you expect these changes to improve care in rural or underserved communities?
Anything we can do to bring more physicians, more nurses, more physical therapists into rural areas, we're going to do. This compact helps make that possible. If you're a nurse or a doc in Maryland, like Hollis is, and you want to be in a rural community in Pennsylvania, you used to have to wait months and months and months to go through a process which probably acted as a deterrent when your skills were needed in so many other states. Now we are welcoming Hollis and others with open arms, saying, come here, we want you. And instead of taking months and months and months, we can get you processed within just a couple days, maybe 3 or 4 days, depending upon the area that you are going into. And if my budget passes as I proposed, there will be financial incentives for those who are going to go work in these rural communities. So it is really, really important that we do this, really important that we protect rural healthcare, particularly given the acts that the federal government just took to rural healthcare. And it's really important that we advance that budget. And it's a great day that we're able to sign this compact now and open up the doors of rural Pennsylvania to more healthcare providers in about 30 other states.
Governor, some of these cuts with Trump's budget bill won't go into effect until after next year's election. Do you think Pennsylvanians will forget by that point?
Well, look, I mean, I think it was obviously a cynical attempt to try and get people to forget about their vote on behalf of by those who supported this bill and by President Trump. I'm going to continue to let Pennsylvanians know, including the 9,762 people here in York County who are going to lose Medicaid, and why they're losing Medicaid and who's responsible for them losing Medicaid. As for the politics of this, you're the pundit. You can decide what the politics are. I care about people, and I care about Pennsylvanians. Pennsylvanians got screwed in this. And it breaks my heart, after all the progress we've made, to provide access to healthcare, provide access to food, to provide access to job opportunities, to bolster education in these communities, that the federal government, with one vote, ripped a good chunk of that away. So I'm going to continue to fight for Pennsylvanians, even though others have turned their backs on them. And I hope that people wake up and see, I hope that the representatives wake up and see the negative impact that they are having on our Commonwealth, and maybe reconsider what they did and go back and reverse this really, really dangerous policy. Dangerous law, pardon me. Anything else? Okay. Thank you all very, very much. Have a great day. appreciate you and Roxana and the entire team here at WellSpan. This is an outstanding healthcare institution. Like my dad, apparently you have to take organic chemistry, calculus, and things like that. Obviously didn't work out for me, but some of my earliest memories are as a little boy, maybe 5, 6 years old, making a different hall we would walk down, room we would walk in. My dad would point out who the nurses were and tell me they're the ones who were really in charge of the place. No offense, Roxana, but I think everybody knows how valuable and important nurses are. We also know that we need more. For every 522 residents, more than 850,000 of our neighbors in Pennsylvania live in communities that do not have enough healthcare providers, according to the federal government. Occupational licensing to one of the best states in the nation. The wait time for a registered nurse and licensed practical nurse license went from 25 days to just 5 days to 5. And let me tell you, with as hard as Al Schmidt works, we're not satisfied with those numbers. We're going to continue to make progress. We're incredibly proud of all the team at the Department of State has done to speed up those times, treating patients far more quickly. Joining these medical compacts, as we are announcing here today, doubles down. What do you think? Is it doubles down or double down? Yeah. We'll just say double down, Roxana. We're doubling down on that. Hollis King, who you'll hear from in just a moment, who lives just across the border in Maryland, though we're already working on getting her here to Pennsylvania, can more easily and quickly get a job here in York County with WellSpan, depending again on that area of practice. Now, that out-of-state license that's part of that compact will be recognized within just days here in Pennsylvania. And that is going to allow that physician to be able to get. I want to create a new loan repayment program specifically focused on healthcare professionals who take jobs in our rural communities. My budget would help pay off student loan debt for doctors.
Thank you, Governor. Today marks the culmination of Pennsylvania's nearly 10-year journey to full implementation of justice and FBI in order to bring about final approval. While the Shapiro administration was able to partially implement the Nurse Compact in 2013 and the Physician Compact in 2014, one major hurdle remained.
Health systems extraordinary efforts to develop, recruit, and retain healthcare professionals. We have a 19 average for hospitals and health systems to recruit the healthcare professionals our communities need. HAP would like to thank the bipartisan group of leaders at every level of government who work collaboratively to make this.
I'm Hollis King. I'm a student here at Jersey College. I received a grant from WellSpan.
I know sometimes the legislative process can seem a bit slow or a bit arduous, but when you have a champion like